Hey, Guam's favorites containing COVID, the K-Wave News, takeover of I-94 FM. Again, our number is 637-0094. Wanted to get the Legislative Health Chair, Senator Therese Terlaje, on the line. Senator, I understand that you've met about contingency plans for Guam's healthcare system. What can you tell us about that, Senator?
Well, as you know, that it evolves, but they're very much working very hard on it. And I think for me, the concerns have always been the same, what we're short of, what our capacity is. And so everyone's scrambling to increase our capacity because all the trajectories show that we will need a huge increase in capacity. So knowing that, that's why we're so concerned about getting these equipment, the ventilators that we need, the PPEs for their frontline workers and the patients, the test kits, and that type of equipment.
So how dire of a situation is it?
Well, so yesterday we were able, I had requested from Dr. Cabrera, because we heard his trajectory a couple weeks ago, to give us an update. So we did that by Zoom with the senators, and I was very grateful that he was very frank with us, because I really feel it's the most important thing right now is that everyone knows the truth and that we are able to act appropriately with the truth, and nothing should be sugar-coated at this point. Mm-hmm. So, of course, the trajectories, they're dire, and they've always shown, Dr. Lombard's, everyone's trajectory has always shown that we are going to reach capacity at the GMH ICU, in April. Mm-hmm. And so those continue to show. And even when, so they give us some options, right? Like if you decrease it by 50%, we're still reaching capacity in April, but it's much less. But we still need more ventilators. We still need more PPE, and we need these things whether we are able to bend this curve or we're not. But at the current rate, even with all of our isolation and quarantine and stay-at-home orders in place, the numbers are huge. So they also predict deaths. And this is what really always gets to me is when they start to predict deaths, I mean, you have to imagine who these are going to be, right? The data shows it's going to be our manumco, it's going to be our most vulnerable, those with, who are undergoing treatment for dialysis, those who are have underlying disease, and it will hit everyone, but those are the ones who might die, and these deaths are just looking more real, and so I think we need to step up our efforts to really lock down the community and stop spreading it. It's out there, it's prevalent, and we've got to stop the spread. I mean,
but you said you met with GMH, or you got a chance to talk with GMH to get an update on the status there, in terms of their supplies and what's needed?
Yes. Well, now these things are all being coordinated now. Dr. Mike Cruz, he's got a team that's coordinating the supplies with public health and GMH and the private clinics, so that we are going to, from whatever source, be able to share where we need to share to make sure that everybody's protected up in the front. The problem is we all know that we will run out at this rate. So, all the orders that have been placed, someone has to track those to make sure they're coming in and that we get them in the time that we need. And so this is really the concern, is that it shows we need them and we need these soon. We need these in April. We might have a peak in June or July, depending on the trajectory, June, July. Those are just, a blink away.
But we need supplies. But what about people? Was there any discussion about
Yes, of course.
Personnel?
Yes. This has always been an issue on Guam. We are short of nurses to begin with. We were short of nurses to treat our patients that were in the hospital before COVID ever came. And we couldn't increase our capacity at the hospital without additional nurses. So, they're trying to find ways to increase nursing capacity. They brought in, students. They've brought in retired nurses. They've brought in all kinds. They've solicited from military spouses. They solicited military. I think they're going to engage the National Guard to bring in whatever medical capacity that is in the Guard that they can bring in, and they've even solicited from the military themselves personnel. I think you talked to Dr. Wen yesterday, who discussed that about 40 personnel are going to come in, and that we're hoping that they're going to be able to assist us as well. And they're looking everywhere for this, so for additional capacity for nursing. Yes.
Senator, I wanted to ask, in the press conference yesterday, the question had been asked of Admiral Manoni about the use of a Naval Hospital and the testing capabilities, and the response that he had was that the military is going to act as a backstop for the government of Guam in fighting and containing COVID-19. In your briefing with the Admiral yesterday, was there any additional information that came out in terms of what type of assistance we're going to be getting from the military?
Well, it sounds like they are going to increase, eventually they're going to have to increase their hospital capacity beyond Naval Hospital. And so they talked about, a warehouse after they're able to move sailors out of a warehouse that's being used for them right now. If those sailors move out, that they are going to try to convert this warehouse into a backup facility, hospital facility. They're supposed to be bringing in additional ventilators, PPEs, things like that. And so he, it wasn't a specific amount, but he did say that, they're going to try to bring in as much as they can, and that set themselves up and then give us what's extra. And then when they set up the hospital capacity, that is backup for GMH, for example.
So these sailors that are warehouse, they are what, positive?
Well, he described the different places on the base that they can set up their capacity to house these sailors are different places. So just one of them was a warehouse. There were other buildings that they were also using, but one of them was this warehouse, and so it's this warehouse that they're hoping to convert to hospital capacity.
Okay, so care facilities.
Right. Senator, did you have any info about the Army Corps engineers? I asked FEMA yesterday. We know they're here. We know they've done a report. We keep hearing retrofitting facilities, to make them capable to serve as, field hospitals. The governor mentioned a barge. Have you had any contact, any communication with anything regarding what the Army Corps is doing on Guam?
I haven't communicated directly with the Army Corps, but my understanding is that they are. That's a possibility. But I know that they did, as Dr. Cabrera said, do their own analysis of our maximum or peaks, peaks in patients that are going to be needing hospital, and everyone. Actually, the Army Corps' conclusion was much worse than Dr. Cabrera's, and so they all show, we're going to need these rooms as soon as possible. We're going to need the ventilators as soon as possible, and that we've got no time to spare. And
was that a no?
Yeah, the conversion of buildings. No, I'm not. I haven't been informed of which buildings.
Right.
Yeah, that's a no.
Yeah. Senator, I saw a letter you had written. It's kind of a subject change, but we're getting a lot of comments, and I've just really been banging my head against the wall, trying to find out what, if any, local assistance we can offer our people who just cannot hang in there. And I feel like I'm speaking an alien language sometimes, but I saw that you had written a letter to Director Byrne asking him to expedite tax refunds, because that's one thing that's not going to require you guys to go into session, or it's not going to require an act of God, right?
That's correct. And if you read the tax refunds report, it's very clear that they have already processed, awaiting payment, 4,398 tax refunds. So, of course, my theory is if that's something that doesn't even need any more work. It just needs, to cut the checks and pay. And that would help, I think, a lot of people. 4,000 people, that's quite a bit. That's more than the, GHRA layoffs at this point. That's about 2,500. So I don't know. You know, I mean, that's one way. There's also unprocessed tax refunds for prior years that, you know, over 2,000 for sure. And I just feel like that's something that can be done even during this period. Hopefully they can find a safe way to do it. I'm sure they can cut checks safely because they're cutting payroll.
Right.
So
Yeah.
it can be done. And so of course Director Burns said, don't worry, we're going to pay all the refunds within 6 months. And I appreciate that. And I appreciate that they've been consistent in paying. But what I'm asking is that this is a very different circumstance. And 6 months is just not sufficient. It's not conscionable anymore. If we can do better, we should do better. And this is one way that we can do better. And we can just get those out and be done with those tax refunds, get that money out there. And that's, you know, that would help people. I am very sure of that. And of course, the other thing is, I heard on the news, but I don't think it's accurate because I talked to, you know, Tess Archangel at Public Health, and she said that the SNAP benefits are available for anyone who's been laid off, and that the applications are up online. Download that, fill it out, put your application into a Dropbox, and if you qualify for SNAP benefits because of your layoff, all you need to do is put in there a letter from your employer that you've been laid off, and that makes you newly qualified for SNAP benefits. And they are processing these within a week of receiving them, she said. So I want to encourage everybody to also do that if they need that SNAP. Of course, it's food benefits, but qualifying for SNAP also qualifies you immediately for Medicaid, and it qualifies some people for cash assistance, particularly mothers or children. And so if you've been affected by a layoff, I think you should try that. To apply right away and see if you qualify.
Right. Yeah. So we asked Linda Denorsi about that, and she wasn't able to give a really clear answer on what type of emergency food stamps are available. But you were able to clarify that with Tess is the program administrator or something, right?
Correct, Tess, and she's excellent. And so I think I'm pretty confident that this is. Because I asked her straight out, "You're sure this is for new applicants?" And she says yes, and that's why she said the proof of employer layoff. That's all they need,
right?
And they're qualified.
But Senator, what about those people who have been furloughed or had their hours reduced? We're still in the gray area with those that group of people, right? Because that's a big group.
Well, of course, if you continue to receive an income that's beyond, above the income level to qualify for these benefits, and then you're not going to be covered, obviously. But that's why I'm looking for other things, and tax refunds one of them. Other assistance programs that we have, and this is really going to be the thing, Chris. It's like if I'm hoping the government's going to really lock down a little bit more to stop this curve, to stop the deaths. I don't even like to call it a curve anymore because it sounds so academic. What we really need to do is stop any more deaths. Yeah. And so in order to do that, we're going to increase our capacity at the hospitals, but we're going to have to just stop the spread of the virus. And in order to do that, I feel like we're going to, without, test kits and other things, we need to lock down more. We really need to be serious. And I know you guys have tried to lead a campaign on this, but it's the most important thing we are going to do for each other is lock ourselves down, stop the spread, imagine that everyone next to you has this virus and act that way and lock it down. But when we do this, I realize that we are going to have some serious food issues. Like you say, there's people who've been laid off. We don't have cash to go get food. And we're locking down. So our ability to go get food safely is really limited. And so I feel like that's something that
tough balance, Senator.
We're going to also have to look at. We're going to, we've got these current institutions such as our Salvation Army, the Catholic Social Services that have done excellent during this time to give out a lot more food than they normally do because of the circumstances with employees, right? And but it's going to increase, and so that is what another thing that we're going to have to, as a government, I feel like we're just going to have to outright, in addition to building making the shelter capacity ready, we're going to have to make food capacity available as soon as we can. I mean, yeah.
Senator, I just wanted to ask, because this is something that I've been really trying to hammer down on the disaster SNAP assistance benefits, and so I had the guy from FEMA on the line yesterday. Linda doesn't know where we're at with that program, and the Frank from FEMA had basically said that that's not one of the programs that is turned on, and that's something that the governor, I guess, has to kind of request an amendment. Can you kind of track that down for us? Because again, that's just
I don't know. Maybe you guys are talking about different things, but SNAP is an existing program.
Right. Yes,
we qualify by income, so it doesn't. We don't need a new program. It's there, and there's capacity. So that's why I'm saying.
Right,
all you need
but
is
Linda has been talking about emergency SNAP benefits because of the disaster declaration that would go to people who otherwise don't qualify for SNAP. So that's kind of what we're talking about.
Oh, okay. Well, that's different. That's meaning you're over the income level. I'm not. Yeah, I don't know about that, but I think I just want to make sure that everyone understands if you have been affected by a layoff, you should qualify. Of course, it's going to depend on your household, but especially if it's just your income, then absolutely you're qualified.
Yeah.
So
that's what I'm saying, Senators. There's people whose income is above the qualification level, but they've no doubt been so adversely affected by,
right.
Right, yeah. So that
but really just... You're over the income level for food stamps, and we need to find other ways. And that's what I'm saying. The government is going to have to look at food capacity while we do a lockdown, because that's the new issue, right?
Yeah, it is.
Yeah. In addition to the health, and I don't know about you guys, but I am so terrified of any more deaths and the trajectory. They talk about 2,000 deaths, and it's something that if you can't get that through your head that people are going to die, then I feel like you're not going to act appropriately. And even in almost the best case scenario, if we can cut the curve today. Even with all the actions we have in place, that's what they're talking about. But if we change our behavior today and we lock it down a little bit more, we might be able to cut it down. And if they predict, if you cut it down by 50%, you're still looking at like 700 deaths. I mean, can you imagine that, Chris?
I can't even.
You're going to know these people. You have to think of it that way, and that's why I'm begging them to not sugarcoat and tell the people the truth. They need to know it. They need to know why we need to keep everybody else out of the hospital, because our hospital is, the capacity for our hospital is strained already.
I mean, Senator, you've been ringing the bell about the hospital since you got into office last term, and I mean, you've been pretty consistent and you've been pretty ignored. We're all dealing now with this. Can't even think of the right word without going profane. But
Kevin, I just say though that I am just so grateful because there are so many people that are really working out there. I mean, we're talking about mandating nurses, mandating anyone who's retired, and to come back to work and to put themselves at risk. Mm-hmm. So doctors do this every day, and I really feel for them because, when you look at the stories from, different places, it's clear health professionals, they're getting infected, and I feel like the rest of us in the community, we need to help them. We need to help them. We need to protect them by getting them the gear, but we need to protect them by keeping ourselves locked down. We need to protect them by taking care of all of our people that have diabetes and every other illness, so that they don't have to go to the hospital. That's our goal. That's another one of our goals, is keep them home and keep them safe. Take care of them, give them whatever they need, healthy food, medicine. That's even becoming a problem.
So Senator, in your conversations with Dr. Cabrera yesterday, have you heard any indication that we're going to see more stricter mandates coming down in terms of like we're going to extend this mandatory social isolation. We're going to implement a curfew law like they're doing in Saipan for everybody, not just for the knuckleheads that are running around.
Well, I think, of course, this type of call is up to the governor. But
I know. I'm just wondering if you heard it in the conversation.
If you look at the charts, they're saying we need to decrease our current trajectory. We need to decrease this immediately, and we want to decrease it by at least 50%. How do you decrease it? You know, and I think it's
getting tough.
There's no other answer.
And I'm just so frustrated, Senator. When I look out here, there's just too many exceptions to the orders, and just people are not. I mean, this it looks like a slow work day when I look out the window. You know.
Yeah. No, I feel that way, and so I agree, and I think you know we've in the legislature started drafting resolutions to tighten the lockdown and things like that, and then we saw enforcement start to happen, and so we were very optimistic, like, okay, great, at least enforce it, but we're just gonna have to, as a community, we're gonna have to really, I'm definitely going to call for that. I want very strict enforcement, very close the exceptions, even if we have to do as much as possible for a short period of time. That will help. Anything's going to help at this point, and we just can't be blind and continue to do what we're doing.
Yeah, I hope you do speak up, because the last time somebody took a drastic position in shutting down the island, locking it down, she got, what did she say, beat up?
Yeah, Vice Speaker. Yeah.
Oh, well, that was very early on.
Right, but Senator, if you look at
you've
how
got the
people
CNMI, and they're like, okay, no flights starting Monday, no flights in and out of Guam.
I totally agreed with her at that point, that we should control those flights that were coming in, and so it was. I just don't want to go back and criticize.
That's in the past.
Yeah.
We got to move forward. What happened with your briefing then yesterday with the because you guys didn't go into session, but there was a briefing that was with the White House that the speaker called?
Well, the White House does weekly briefings with all state legislatures.
Okay.
So they invite everyone to.
So that was nothing special?
Oh, it wasn't a hookup.
We all join in. It gives us an update. It's kind of like FEMA gives a daily update, on what's happening, and the White House gives, I think, a weekly update. And
is this the first time you guys were invited?
No, we've always participated.
Okay, the press release made it sound like, oh, you guys can join us.
Well, I'm not sure if all senators are getting all of the links, but like me, I get it through my email.
Right.
But what I want to say is, some of those briefings are, the good thing about them is they give us some hope about the new technology that's been approved by FDA, like that kind of up to the minute updates on. So then, once I hear those kind of things, I make calls all day long, and I track down somebody who's going to order these FDA kits, the newly approved FDA kits, things like this, because, I just feel like, and I'll admit it's frustrating, and so I can't imagine, the other people, but I just, my mind is, I can't get my mind around why don't we have the additional ventilators at this point, right? When we knew from day one we need it, and so that's why I just hope everybody concentrates on that, gets this capacity. I don't want anyone to die. I mean, that's really. Nobody wants that. I just feel like skip everything, and let's just talk about deaths. And if you limit it to that alone,
I know that the governor did mention that the goal, right, is to increase our bed capacity to 2,000. And so I'm just kind of surprised that you haven't really heard anything about that plan.
Yes, well, I think Dr. Cooper, they've told us a little bit about the plan. I'm hoping he's going to further brief us. These guys have a lot of meetings, and they also taking care of patients, so it's very hard to get. Like, it's not like our regular, legislative sessions where we can call them in and get all the information that we need, or we feel like would help us to.
Wow, wouldn't that be nice if you had a session where you could call these people in?
Nice. Right. Yeah. So, of course, But anyways, he was very gracious to give us the full trajectory analysis. And of course, after that, I told him we're looking forward to his breakdown of, exactly how they're going to reach this 2,000 capacity. So they have it all planned out, and I'm very confident about that, these guys are working hard. So I'm glad. We have a plan to reach 2,000. But the problem is, reaching 2,000 in their trajectory, 2,000 beds means, so many will be in ICU, and then, those kind of numbers are also there. And
Senator, are you hearing from nurses or any healthcare workers about burnout or stress or anything like that, or what they're dealing with, and whether they're getting enough support?
Right.
Of course. No, they're stressed, but I they're brave. Gosh, they're so brave, and they're doing this for us. I'm totally out of love for the people of Guam, and that's why I say I'm so grateful for them. But and they get worried, like, oh man, are we going to run out of PPEs? But that should not happen. If we are doing our jobs correctly, that should not happen.
Right. It's not their job to worry about that.
Yeah. But I was just wondering, because, we don't hear.
No.
I think people need to hear that.
The thing that I worry about them right now is, with our shortage of tests, that we're not testing healthcare workers a lot. We're only testing those with symptoms, and I'm hoping that when we get some more of these tests that they've been promising, that when they come in, that, that's what they want. I think some of them want to be tested and they're not being tested. And so I just hope that they can at least work with assurance, that they're not transmitting this disease further. And that's, you see this across the different, hospitals in the nation, that's a huge risk. And they, I don't know.
Senator, I just got a tip, and maybe this is something that you can look into as the health chair, but where are we in terms of, I know that we've hired new nurses, but I got a tip that some of the new hires are being told you will get paid. We're just not able to say when. They haven't been paid.
No,
we don't know if they've been processed.
I received that complaint as well. But, those who are hired by the government, they should be paid at payroll, So, and Ed Byrne has assured me that anyone who has been hired by the government is going to be paid on the next pay day.
In next week? I mean, in 2 weeks or today?
Well,
today's Government Pay Day.
It depends. Yeah, if they were hired prior.
Okay.
Right.
Okay. After. I get it.
Be the regular timing. So sometimes, if you get hired, you have to wait till that next pay day.
Yeah.
But they're not being paid.
Okay.
So I think, there may be a few of them who have been called to duty who are not sure the rate that they're being paid, and that's just a problem with the agency.
And it kind of looks like from the complaint that they were activated, called in, and they just went to go to work, and maybe a week later,
Forgot
like, oh wait,
do
am I
it.
getting paid? How's this going to work? So
and they should be paid. And that's what I'm saying. These agencies, they're scrambling, so I give them a lot of credit. They and they might have some errors, but that's not supposed to be the process. Everyone should be paid. Yes.
Okay, Senator.
Yes, thank you so much. You guys, thanks for doing this good job and making people stay home. I mean,
please stay home.
It's not even a joke anymore. It's not.
Really?
We're going to save some lives here, and that's what we all need to concentrate on. So thank you.
Well,
Thank
welcome on,
you.
Senator. Thank
Thank
you.
you, Senator.
All right.
Keep us posted on those tax refunds, okay?
Sure. Okay.
Okay. Oh, there you go. 7:38. Legislative Health Chair Senator Therese Terlaje. We're going to take a break. We're coming back with Mary Rhodes from